As a parent, there's a moment around the 6-month mark that can be both exciting and confusing. Your baby's first tooth might be making its grand entrance, but at the same time, you might notice a runny nose, a slight fever, or unusual fussiness. You're left wondering, is my baby sick, or is this just teething? You're not alone in asking this question. In this video, we're going to unravel the 6-month coincidence and give you the scientific facts to tell the difference with confidence. Around 6 months of age, two major biological events often happen at the same time. First, teething begins. For most infants, the first primary teeth, usually the two bottom front teeth, start to break through the gums. This is a normal physical process that can cause some localized discomfort, drooling, and a desire to chew. Second, this is the age when many babies experience their first minor infections. A low-grade fever, a runny nose, or an upset stomach can suddenly appear. For centuries, people link these two events, creating the myth of a teething illness. But science tells us a different story. It's not a story of cause and effect, but one of remarkable coincidence. To understand the coincidence, we first need to talk about the immune system. During the final months of pregnancy, a mother passes on a powerful gift to her child, her own antibodies. This is called passive immunity. These maternal antibodies, specifically a type called IgG, enter the baby's bloodstream and act as a temporary borrowed shield. This shield is incredibly effective, protecting the newborn from many common viruses and bacteria in their first few months of life. But this protection isn't permanent. The maternal antibodies have a half-life of about a month, meaning their concentration is cut in half every 30 days. By the time a baby reaches 6 months old, this initial protective shield has almost completely disappeared. This leads to a critical window known as the immunity gap. Maternal protection is gone, but the baby's own immune system is still developing. It's learning to produce its own antibodies, but it's not yet strong or experienced. So, just as their inherited defenses are at their lowest, another developmental milestone kicks in: exploration. At 6 months, babies begin to master the art of grabbing objects and bringing them to their mouths. This hand-to-mouth exploration is a vital part of how they learn about texture, shape, and the world around them. However, it also serves as a direct delivery system for new viruses and bacteria. This creates a perfect storm. The baby's natural curiosity and desire to explore introduces pathogens into their system at the exact moment their immune protection is at its most vulnerable. This is why the first cold or stomach bug so often strikes right around the 6-month mark. So, how can you tell what's really going on? The key is to look at the full picture. Teething symptoms are almost always localized to the mouth. You'll see swollen or red gums, excessive drooling, and a strong urge to chew on things. Your baby might be more irritable, but it's usually a mild fussiness. A slight rise in body temperature is possible, but teething does not cause a true clinical fever. Infection, on the other hand, causes systemic symptoms. A fever above 38 degrees Celsius or 100.4 degrees Fahrenheit is a clear sign of infection. Look for other signs that affect the whole body, like lethargy, inconsolable crying, a cough, congestion, vomiting, or diarrhea. These are not symptoms of teething. The most important takeaway is this: attributing a high fever to teething can be dangerous, as it might cause you to overlook a real infection that needs attention. The overlap between teething and a baby's first illness is a fascinating biological coincidence, not a causal link. So, when your 6-month-old is feeling unwell, comfort them for their teething discomfort with a chilled teething ring or a gentle gum massage. But always investigate the other signs. Monitor their temperature, watch for systemic symptoms, and never hesitate to consult your pediatrician if you're concerned. Understanding the science behind this milestone can help you navigate it with less worry and more confidence. Thanks for watching!